Hi, I'm Dr. Jeff Rohde with Dentalcompare. Today we're talking about the integration of GALILEOS 3D cone beam technology with the CEREC, and we're here with Dr. Patel. Dr. Patel, thank you so much for joining us.
Thank you.
Now, you're a neurosurgeon, you've been using the GALILEOS. How have you seen this change the way you do dentistry?
It's very much simplified the way I treatment plan my patients. Not only is it easier for me to diagnose, but it's very easy for me to implement surgical placement of dental implants along with the restorative dentist. So the communication between the referring dentist and myself is so much more simplified, and the workflow from diagnosis, from scanning, all the way to the final restorative placement and restoration is become so much easier, structured and systematic.
Right, and and that's something that I know is becoming more key, is that we're restoratively determining the position of the implant. And so integrating that CEREC, I mean, you've started to do that.
Yeah, it's become, patient acceptance has immensely improved and increased. You have the restorative dentist who does a digital impression of the dentular space, places where they want the ideal restoration. I scan the patient, I place the implant to the ideal position of their restoration, make a surgical stent where necessary, and it just makes everything very easy and systematic.
Now, how are you making your surgical stents? Are you using the same system to do that?
Yeah, we're just doing everything through SciCat and sending the scans out.
Right. So, and then what kind of reports then are you able to generate for your restorative dentist after you do all this kind of stuff?
I can give, when I send the CD to my restorative dentist, they have the exact placement of the implant, the type of implant, the location, and everything's very precise and very true to what we want to achieve clinically. And it just makes things so much easier and better for the patient too.
Yeah, that's great. So you can actually give them a disc and they can see the whole 3D volume and everything.
Absolutely, absolutely. We give them a disc, we communicate constantly on the phone together, and it's just a great symbiotic relationship between the two machines and the two dentists. And it just makes it easier for the patient too.
So now you're talking about that communication. I mean, that is important. But it seems like a lot of what people think cone beam is for is implants.
It's a lot more than that. I mean, as an oral maxillofacial surgeon, now I have the cone beam. I can precisely look at pathological lesions, the extent of them, and it will determine how I surgically manage them. Not only does it allow me to see more pathology than I've ever seen before, it also helps me to rule it out, which is important too. Right. I mean, I have numerous cases where a dentist will send me a plain film and say, you know, I think I see something, can you rule it out? I look in a 3D scan and I can tell immediately if it's something I should be looking at further, right, or doing some other type of treatment for it. So, and you know, now I have 3D, I can't imagine how I even function with 2D plain film, films.
So you would never go back?
Never. There's no need. I see everything I need to see in a 3D image.
Well, Dr. Patel.
Pleasure.
Thank you so much. I'm Dr. Jeff Rohde with Dentalcompare.